Question: A 65-year-old male presents with progressive memory loss and cognitive decline over the past year. His family reports personality changes, social withdrawal, and difficulty with language. On examination, you note bilateral parietal and temporal lobe atrophy. The patient has no significant motor deficits. Which of the following is the most likely diagnosis? A. Alzheimer's disease. B. Frontotemporal dementia, FTD. C. Lewy body dementia, LBD. D. Vascular dementia. The most likely diagnosis for this patient is Option B. Frontotemporal dementia, FTD. This patient's clinical presentation and examination findings are suggestive of frontotemporal dementia, FTD, specifically the behavioral variant. Here's the rationale for choosing this diagnosis. Clinical presentation: the patient presents with progressive memory loss, cognitive decline, personality changes, social withdrawal, and difficulty with language. These symptoms are characteristic of FTD, which often presents with prominent changes in behavior, personality, and language rather than memory impairment in the early stages. Examination findings: the noted bilateral parietal and temporal lobe atrophy on examination is in line with FTD's characteristic patterns of brain atrophy. FTD is associated with atrophy in the frontal and/or temporal lobes of the brain. Now, let's consider the other options. Alzheimer's disease. Option A. Alzheimer's disease typically presents with progressive memory loss as the initial prominent symptom. While behavioral and personality changes can occur in Alzheimer's disease, they often appear later in the course of the illness, after significant memory impairment. Lewy body dementia. Option C. Lewy body dementia can present with a combination of cognitive decline, visual hallucinations, and motor symptoms resembling Parkinson's disease. While personality changes and language difficulties can occur, they are usually not the predominant early features as described in this case. Vascular dementia. Option D. Vascular dementia is often associated with a history of cerebrovascular disease, such as strokes. It can present with a wide range of cognitive and neurological symptoms. However, the clinical presentation in this case is more suggestive of FTD, with its predominant behavioral and language changes. In summary, given the patient's symptoms, including prominent behavioral and language changes along with the characteristic pattern of brain atrophy, frontotemporal dementia, FTD, is the most likely diagnosis. It's important to note that FTD encompasses a spectrum of clinical presentations, including the behavioral variant seen in this case.